research and evaluation. And you're talking today about kind of this fuzzy area between evaluation and research. So glad you're gonna probably touch on that at some point too. So let's give Eva our attention, and the floor is yours.
All right, thank you so much. Can everyone hear me okay?
Yeah.
All right, let me know if I get too quiet at any point. So as Leslie mentioned, I'm Eva Shapiro. I work at Westside United. I'll talk a little bit about the organization later, but I was asked to share a little bit about my public health journey. And I just want to throw it out there. If you have any questions, I'm always thrilled to talk to public health students and potential colleagues. So I'll share that, again, talk about Westside United. So I'm going to give you sort of like a real life evaluation experience that we're doing with one of our programs. So I'll share about the program, which is our small business grants program, and talk about our evaluation approach. And then there are so many challenges that come with real world application of evaluation. So I have a few to share, and I'm curious to get your feedback and thoughts about how we could approach some of those challenges. All right, so about me, a lot of it was in the intro. I got my BA from University of Minnesota, and I did some public health research there, which was really my first introduction to this whole idea and community of public health. And then I worked as a community and labor organizer for 3 years, and was really, I think, inspired by that experience and by working with healthcare workers who were, we were mostly working with home care providers who were making minimum wage, often didn't have access to healthcare themselves, yet were providing vital and necessary services to some highly vulnerable populations. That really inspired me to want to pursue more systems change work in terms of health access. So then I went to get my MPH, and after that, I worked for 5 years at NORC at the University of Chicago. NORC is a nonprofit research institute. It started as the National Opinion Research Center. They did public polling about 80 years ago, but they've since expanded. So when I was there, I did basically nonprofit consulting. So we worked with CMS, Centers for Medicare and Medicaid Services, to do some evaluation work for them. We also helped out with some projects, basically whatever they didn't want to do themselves, they hired us to help them do. So I got to work on a few cool projects with the Office of Minority Health. Lots of learning. I will say, I think my takeaways from there was that it was a really big organization. So all the jobs were pretty focused. So we had a lot of mixed method studies, but there would be a biostatistician or sort of an quantitative expert who would run the quantitative analyses. I focused more on qualitative, and so that was great for our studies, but it didn't give me the opportunity to really practice and hone those skills. Now at Westside United, we are a very small organization. We're incubated at Rush, which of course is huge, but we only have 14 people. There were 7 people when I started. So now everyone does a little bit of everything, which is sort of how it goes, I think, at small nonprofits. So very different experiences, but both tons of learning, tons of opportunity. And I'm happy to talk both about what we do at Westside United, as well as my experience at NORC. I think it's a great place if that's an avenue you want to pursue. Any questions about me? Right. So Westside United, first, is anyone familiar with Westside United? What do you know about Westside United?
Yeah, I mean, I feel like you guys are always at table, your name is popping up in those, right? We look at all the organizations that are addressing on the west and south sides of the city. Yeah, I won't give too much, but seeing, having heard your talks from the years before, so.
Well, glad to know that we are out there. Has anyone else heard of Westside United? Okay, we're pretty new. We started in 2017. So originally 3 kind of hospitals came together, inspired by some mission changes that were more focused on health equity, inspired by data that came out of their health needs assessments, which they are obligated to do every 3 years. They began to think about how, as hospital systems, could they approach community health needs on the West Side, which a lot of these hospitals were serving. So they held a series of community conversations with about 400 Westside community members and over 100 leaders from different organizations to really test out the idea of are folks interested in this health collaborative that's kind of related to the hospitals? And also, what are the pressing health issues and community needs that you see in your neighborhoods? So by the end of that year, community members said like, yeah, we're into the idea of this health collaborative, especially if it's going to bring additional assets to our neighborhoods. So planning committee formed, and that was the basis of the organization. So we have seven healthcare anchor institutions, which are up here. St. Anthony, we love them. They just joined the latest. So after this graphic was made, and you can see that these are pretty diverse hospitals. We've got a couple of safety nets, public hospitals, as well as kind of more resourced hospitals like Rush and Lurie Children's. So they definitely bring different like assets and challenges and contributions to the organization. So our aim as an organization is to reduce the life expectancy gap between West Side neighborhoods and the downtown area. So this is a map of the West Side using sort of like the L's as the route. And you can see, and you probably know this, if you start downtown, your life expectancy, this 2020 data, is 82. And as you move west, depending which way you go through the West Side, it can drop slowly or very precipitously. So if you go just a couple miles between the near West Side, which I think we're near West Side, to Garfield Park, you lose, almost 10 years of life expectancy. And I'm sure if you've ridden the L or taken a bus west, you can see that the neighborhoods change in terms of empty houses, empty lots, kind of the retail corridors. And so all of that is like what we think about on a daily basis at West Side United. So we cover 10 neighborhoods on the West Side. Let's say Belmont Craigan isn't pictured here. It's a little bit northwest, but they're included because several of our hospitals really prioritize that neighborhood. So I want to acknowledge that the neighborhoods that we cover are not homogeneous by any stretch of the imagination, even though, we talk about the West Side a lot. So 4 are primarily Black, 4 are primarily Latino, and 2 have experienced a lot of gentrification over the last 10 years. So there's quite a mix in terms of what like challenges and assets are in each of the areas. I'll say one big commonality is that, residents in these neighborhoods have experienced a lot more social determinants that have negatively impacted their health than residents who live on the north side or in the central area of the city. So our mission is to build community health and economic wellness on the West Side and create healthy and vibrant neighborhoods that people are able to live in. What we want to avoid is creating conditions for gentrification. We use cross-sector, meaning like we work with government, we work with private businesses, we work with community organizations to really focus on place-based initiatives. And as I mentioned, our focus is on reducing the life expectancy gap between neighborhoods. So this is our strategic plan, and these sort of beige-ish boxes are all the different programs that we do. So in the far left side, I won't go through all of this, is our anchor mission work. So when we were formed, of course, we have these 7 hospitals at our root, and a lot of what we wanted to do was to use the economic engine of these hospitals to improve kind of access to resources on the West Side. So we work with the HR departments at the hospitals to increase hiring of West Side residents. We work with the procurement staff to make sure that they're seeking out small West Side businesses to do more contracting with. There's like $4 billion worth of purchasing every year from these hospitals. And we think if we can just allocate like 1% more of that to West Side businesses, think of the opportunity that could grow there. So that's a huge bucket of work that we do. And the program that I'm going to be talking about is sort of in that anchor mission bucket. It's the one that's highlighted, small business grants. So we also do more health focused work. So our 2 priority issues are maternal and child health and hypertension. MCH, because community members in those early listening sessions said like, this is something we really care about. And there are also huge maternal mortality disparities between Black and white women in Chicago. And hypertension, because it's like the #1 cause of the life expectancy gap between West Side neighborhoods and Chicago's downtown. We also do a lot of convening. So as I mentioned, we're at a lot of tables. So we're sort of like a coordinator between health systems and between community members. Because of our connection to Rush, we've been able to get a lot of resources. And so what we've tried to do is pass those through to community-based organizations that may not have whole development teams or may not have connections to funders, but are doing like really fantastic on the ground work. And then finally, we also have a few pilots. So folks come to us sometimes with ideas and we help implement different strategies around school-based hubs. We had a Veggie RX program around healthy food access. And then we're part of the Sankofa Wellness Village, which is being developed in West Garfield Park and recently won the Chicago Prize. So we do a lot of different types of work. All right, any questions about Westside United? Yeah.
Like procurement from the hospital, like them contracting out with the businesses in Westside. I once read this book that was about how ridiculous some of the requirements are for like government funded things. Like they'll specify the kind of hammers that contractors have to use. How, like, do you do more of the work of like pushing hospitals to hire them, or do you do the work of like helping those businesses navigate the insanity that is getting all the requirements to bid for a contract like that?
It's a really good question. So a little bit of both. So we work with the small businesses to develop capacity. Like some small businesses don't have websites. They like barely have their own emails, just like somebody set up a storefront and they need a little bit of help to get to a position where like there's I think a reasonable expectation of what they're able to accomplish. And then there's definitely the systems change work, which I would say is much harder, getting these like huge bureaucratic institutions to make changes. So one big one is their payment policy. So some hospitals like don't pay out for 90 days after the services are done, 3 months. And so for a really small business, like just a mom and pop operation, that like they can't survive waiting 3 months to get paid. So I know Rush with some local vendors, they've now moved to a 30-day payment policy. So we do things like that, which is so much harder than getting businesses trained, just because, you know, you have like this huge institution in motion and it's hard to move the ship there. But yeah, from both ends. Any other questions about Westside United? That sounds like a good look too. Okay, so I'll talk about our small business grants program, which is one of our favorite programs. So we provide small grants to small business owners across the West Side. Our first year, we provided grants. We gave $13,000 to startups and $25,000 to established businesses. We had a much smaller cohort. And we got feedback from community members that they thought it made more sense to give smaller grants to more organizations. So since then, we've been doing $10,000 grants and had like larger cohorts. So we've distributed about $1.8 million to 140 businesses over the last 4 years. And this is on an annual cycle. And it's the amount is kind of based on the amount that we can fundraise, because all of these dollars come from private just funders. But it's a really fun program and one of the ways that we get to interact with community members, because we don't do a lot of like direct service. We're doing a lot of institutional work. So we worked with the, oh yeah.
Explain a little bit kind of selection process for like small business, like the grant and like how much.
Yeah, so we work with Allies for Community Business, which they run the hatchery. If you've seen that, it's off of the Kedzie Green Line stop. So they do a lot of like small business development work on the West Side. And they help with the application process. So basically we try to be as accessible as possible. So again, like we've given money to startup organizations. They just need to be able to fill out the form, which I would say in terms of small businesses getting loans is like a pretty low threshold application, because we want to be as accessible as possible while still like supporting businesses that have a little bit of vitality there. So the businesses, they're first like reviewed by Allies for Community Business that does provide loans. So they have a little bit of expertise and a lot of expertise in sort of assessing like financial stability of businesses. So basically, if you completely fill out the application and can kind of demonstrate a solid business plan, then you go to the second round. And so we have work groups for each of our initiatives that include community members on each of the work groups. And so then we do a review process. So this last round, I think we had like 400 and some applications, about 150 made it to that review round. And then we just like read through each application and picked the ones. We tried to be, we don't try to be, we are equitable in our distribution of grants across West Side neighborhoods. So we make sure that there's pretty equal representation with like a little bit more skew towards neighborhoods that are sort of underrepresented by small businesses like Austin, East and West Garfield Park, and North Lawndale. Even then you.
So I have two questions about that then too. So you said that you prioritize neighborhoods that might need it more. So would you prioritize, like Black-owned businesses or businesses, like where, and the two-part question to that, is there data on these, are you following these people who do receive these grants? Is there demographic data on them? Are you measuring their deliverables? And maybe you'll get into this, I'm just too ahead of myself right now, but are you equitable in just geographically? Are you equitable for other social determinants of health? I guess with the question.
Yeah, good question. So the second part we'll get into with the evaluation. That's part of what we're tracking. And we collect demographic data. I'd say 98% of the time people give it to us. And most folks are demographically representative of the neighborhoods themselves. So most of the applications in like Pilsen come from Latino business owners. Most of the applications from Lawndale come from Black business owners. There was one sort of interesting case, like in our last round, one of the business owners, which was located, maybe they were in Pilsen, but the business owner was white. And so the committee was a little, and they also had a pretty good revenue, like stream already. And so we were sort of resistant to give the grant to them. But our community board member who's in the work group said, actually, this company gives a lot to the community. They sponsor like the kids teams. They're like really embedded in the neighborhood in a way that, us as outsiders didn't know. So we ended up giving them a grant, even though they were like a white business owner. But I would say for the most part, it's Black and Latino. I think 95% of the recipients are either racial ethnic minorities or like low income.
You're giving out grants, right? At the point you said the word low.
Yeah, so typically people get, like, that's all you can get as a business owner if you're even able to get a loan, but these are grants. They get to keep the $10,000.
That's like.
Yeah.
Why you were.
You guys look for specific types of small businesses or really just like any type of small business that fits the criteria? Great.
So many great questions. Yes, we do. So as we're trying to, like, this is the small business community end of that like procurement pipeline, we do sort of call out and prioritize grants to businesses that the hospitals are more likely to like spend money with. So that's a lot of like food service, catering, landscaping, custodial service. Basically, if we think we can start to develop contracts with those small businesses, we're prioritizing those categories. So for this last round, I think there are 5 or 6 categories that we focused on. And if we didn't fill all of our grants with those categories, we're open to supporting other businesses. But we ended up having enough really strong applicants that we just focused on those categories. Yeah.
Do you guys teach about this stuff too? So like, let's say I have a person with a business idea, but I've never explored that. But I, like that's kind of what this is made for, those people who just really need that help, need that leg up. So do you guys have like classes or trainings, or is that something that you project to do in the future to try to encourage that growth more too?
Yeah, a little bit of both. So in this last cohort, we started a partnership with 37 Oaks that does small business training. We don't do the training ourselves, but as any small business, you're able to get free assistance from Allies for Community Business, which is like our partner on this grant, and we let folks know that. But then also as like a grantee or cohort member, we host, we call them like coffee talks, and then we have quarterlies, like capacity building seminars, things like that. And some of our funders are also really interested in providing capacity assistance. So one of them is Wintrust Bank, which does a lot of more like community-based banking. And so they held a couple webinars about like I think it was on like managing finances, like spreadsheet. Yeah, so we do a little bit of the capacity building too, and this is like the first big year that we've been doing it. We're going to keep increasing that in the future. Any other questions about this program? I'm glad you're so interested. I'm happy if you know small business owners. Again, we do this every year, so I'm happy to hook you up with somebody. Okay. So we worked with Sinai Urban Health Institute. Are folks familiar with Sinai Urban Health Institute? Okay. If you're not, you should be, particularly if you're interested in evaluation and research.
But I hire a lot of UIC grads.
Oh, good.
Yeah, their work is so amazing.
Great. They're, I would say like our number one partner across the board. So they conducted the evaluation. And I want to be explicit. The first 3 years of this program were funded by JP Chase, which had an Advancing Cities program. So we had a good amount of money to put towards this program, which included $500,000 for this evaluation. They weren't just evaluating this, they're evaluating another project too, but like the resources that you need to conduct good evaluation are like pretty substantial. And we are not able to get into this depth of data collection with our other programs because it's like just me and my teammate. So what they did is they drafted the evaluation questions. They defined the metrics and the goals. They talked about the data sources and drafted up an evaluation plan and talked with all of our partners about that. And then they've done all the data collection and analysis and reporting. So our 3 research questions were related to outputs, outcomes, and sort of systems change. So the first was, what is the decomposition of small business grant costs into administrative and grantee awards? So basically like out of the grant money that we got, how much did it cost to like run the program versus how much went out in actual grants? Because I think ideally you want to minimize the administrative costs in terms of like the grant that you're able to give out. And then what's a sustainable cost per small business in terms of keeping the program running? Our outcome was related to whether Westside United increases economic opportunity for underserved populations. And then our systems change questions were around how and to what extent does Westside United achieve meaningful internal and external systems change throughout better aligned and integrated systems. So that refers to like this pipeline between the hospitals and the small business community. So my first question for you is, how would you measure this outcome question? It's a pretty big question, looking at how this program, it says Westside United, but think of the program. How does this program increase economic opportunity for underserved populations?
You could ask people, like the population, for instance, and form.
Like all Westsiders?
Small business people who got the grants, like.
Okay.
Small business owners, let's say, and see what they thought about it, or maybe people who have access to services from the small business and stuff, and see what their perception is.
Is that like economic data for the number of, like the amount of like taxes going into the community basis from small businesses? And see if just like the tax base of businesses is going up in that area?
Great, so we've got like a sort of program specific evaluation and then more like community evaluation. Any other ideas?
How we measure employment for these small businesses, like how many people they employ and maybe the demographics of the employer.
Great. Any other ideas? Okay, we did a little bit of each of them, or Suki did a little bit of each of them.
Okay, really quickly.
yeah.
I think that we talked about, we glazed over a lot of cost evaluation. I think we're really focusing on like the process and the outcomes for
Mhm.
this class, but can you just quickly talk a little bit about your cost evaluation? Do you have any economists on your team, or, you know, like, right, you're often asked to do cost evaluations, like, you don't have that background necessarily, but can you just explain it a little bit, maybe some of the metrics that you used, just the real world example for us?
Sure. So I don't think Suhi has economists on their evaluation team. This came up with another grant. But this is pretty basic. Like, we're looking at the total program costs, and then basically just from a budgeting and allocation perspective, like, where did funding go? So let's say we had $100 for this program, $20 were spent on my salary, Suhi's salary, our program director's salary, and $80 went towards the grantees directly, just as an example. So then it's basically like a simple percentage of how the administrative versus program costs.
This is something that, well, I mean, it's simple, but it's very, it's a powerful reporting, you know, was this funder required, or was this like, oh, we want to do this on our own?
Yeah, it was funder required. And I will say this is a sort of unusual grant in that JP Morgan Chase was working with ABT, which also does evaluation. So they were doing these advancing cities grants across the country. And all of the data was going into ABT that was doing like the national evaluation for JP Morgan Chase. So they had more of, I'd say, compared to a lot of funders, they had like this evaluative perspective and experience to ask questions like this that a lot of funders like wouldn't really think to ask. Okay. So this was a logic model. I'm sure you probably can't read much of that on there. I'll blow it up. That Suhi put together that really outlines like all of the different components of this program. And have you guys talked about logic models? A lot. Okay, great. So you see a lot of the components of it. I would say one thing that I don't often see on logic models is the systems change. So at the bottom, there's internal and external systems change. And that's because part of what we're doing as an anchor mission organization is to like change how the hospitals are relating to small businesses. So that was really important for us. And also Rush was the entity that had applied for this grant. It was kind of like right when Westside United was forming, and Rush is our fiscal agent. So there was a strong tie-in to kind of like what hospitals were doing in terms of this work. So when I'm planning an evaluation, I really like to start with the logic model and use that as the place where I figure out what data I'm going to be collecting. And I look through, you know, everything that comes out in the outputs and the outcome section. And then basically it's a matter of like, what is feasible to collect. So we collected a lot, not everything that's here. But outputs are things like the number of businesses that attended our info sessions, the number that applied, the number that got grants, the amount of dollars that went out. There was some things around community engagement. So we had community members, we have a community board. So the number of community members that were engaged with reviewing the applications, and sort of the number of organizations that were helping to promote the info sessions and were like partnering with us on the info sessions. Outcomes were more around those things like increasing revenue and income, creating jobs, sort of those downstream effects that we wanted to see. And ultimately the impacts were around enhancing the small business community on the West Side. So here's just a blow up of the outputs and intermediate incomes and our systems change, just so you can see it a little bit more. So some of the systems changes that we were looking for, and also it's a little bit different here is, I think usually in logic models, like you don't put specifically what your goals are to accomplish, but that was something that was embedded here, I think probably as part of the application requirements. But of course, we wanted to raise hospital awareness of local small businesses, engage community members in the process, provide small business owners access to equity that they don't need to repay, connect them with hospital supply chains, a lot of different things that we're aiming to do. So after the logic model was built and there were these goals established, we started developing the data collection plan. So what we did is we identified, and I say we, this is like Suhi that did all this. But Suhi identified all the data sources that they could pull information from and then lined them up with the big questions. So we looked to administrative records, as well as stakeholder interviews and feedback from the programmatic team to learn about that cost effectiveness. Outcomes were gathered from grantee reports. So each cohort of grantees was expected to complete an entrance and an exit survey that asked them well-being questions at the beginning, but then also like revenue questions and about the number of employees, so we could really understand like whether their businesses grew over that year. There are also stakeholder interviews, and then we used all the data sources to look at systems change. And then you have to create a plan for how you're collecting that data. So we figured out how frequently we could collect the data and where it would come from, and who was going to be doing it. So Westside United was responsible for like our own administrative data, and then to give Suhi like feedback via interviews. And then they were responsible for collecting the grantee reports via survey, and then conducting the interviews with both grantees and stakeholders. So stakeholders were like Allies for Community Business, our work group members who are helping review applications, and some of our organizational partners in the community that helped with info sessions. And then the final piece for an evaluation is reporting. So they were required to do 3 white papers. So the first year really focused on the program development. We were just like getting going in that first year. So they talked a lot about sort of fidelity to what we had said we would do in the proposal. Year 2 is more around the interim outputs and outcomes, and year 3 will be, it's coming up in July, kind of the final evaluation for the program. So I next have a number of challenges to share with you. Before I get into those, are there any questions still about the program or about the evaluation approach?
What happens after your 3 years over? Is JP Morgan giving you money, or do you have to now go out and find money?
We have to find more money. So actually this last cohort that we just gave money to was like our own. It was like a little bit left over from JP Morgan Chase, but mostly new fundraising that we did. And it's going to be kind of like new fundraising moving forward. And one thing, is in our research question, but like thinking about sustainability, and as a nonprofit that's like fundraising, there really isn't sustainability. Like you're always trying to secure more dollars. But I think we're trying to figure out if there's maybe for-profit businesses that want to embed this into their philanthropic work and have sort of like ongoing maintenance of this program, rather than like just trying to get 1 to 2 year funding support each year. Is there another part to your question? Is that it? Okay. Any other questions?
That's a really good point, and I think like we talked about this a lot of just this like constant hustle with our programs and evaluation, but in terms of sustainability, like if your team did have the ability and resources, going back in 5 years, are the hospitals still using those same local vendors? And like we talk about that so much in this class, like we're not always measuring those outcomes that we would like to measure just because of time and money. But it's, really grateful to you sharing an example on this, this program versus like behavior change with knowledge and, in our community settings. And we talk about these examples, but not a lot of people are doing them in the real world because people don't fund this work.
Yeah. And I will say one thing I was going to add. So now that it's the program Advancing Cities has ended, the funding has ended, the program's not ended, but funding for Suhi's like $500,000 valuation has ended, and now we're bringing it in-house we've got a few, I think we have a larger evaluation team than most small nonprofits. We have 3 people, but we're like really scaling back the data that we're collecting, and also trying to figure out how to streamline the collection. Because as an evaluator, a lot of what you're doing is like hassling people to give you information that maybe at one point they agreed to give you, but can't be bothered anymore. So it's just a lot of time sending a lot of emails. So we're trying to figure out how to like embed some pieces of data so we don't have to keep doing that. Okay, so perfect segue. Challenge number one, collecting data. So we had these surveys that we asked the small business owners to complete, both an entrance and an exit survey. And we had a response rate of 40 to 60%, which for surveys is pretty good. What's not great is this was a requirement of being a grantee, but they've gotten the money and we want to maintain positive relationships with community members. So like, what are we going to do? Oh yeah, there was a $20 incentive to complete surveys after program completion. So not for the entrance survey, but for like the exit surveys. And then there were some follow-up surveys every 6 months for, I think, 2 years. We were doing follow-up surveys. So with that 50% response rate, like what would you do? And how would you plan for the next data collection period? Yeah.
I was wondering if the $20 incentive almost made the survey seem optional. It's like.
Okay.
The story, I don't know how to like, the story is about like daycare centers. And if they, like, they have problems with parents picking up late, and then they'll do late fees. But then parents just see it as like, kind of like parking tickets, like, oh, I can pay my way out of it.
Oh,
And people that
interesting.
can't pay their way out.
Yeah.
and Then more parents start picking up late because they don't see it as like a social problem anymore. It's just, okay, if I can pay to pick up late, I can pick up late. So I wonder if programs, participants saw the $20 incentive as like, oh, it's really nice if I do it, but it's not really a requirement, because they're still paying me to do it again.
Mhm.
And I just don't have the time and it's not worth it.
Interesting. We'd never thought of that. Well, we don't have any allocation to pay them moving forward now that the grant has ended. So we'll see if they're inspired to respond more. Any other ideas about how you would approach this response rate?
I have a question before I.
Mhm.
So is there, once you get a grant, is it possible, and I know you guys only done this so long, but is it possible to get a grant yet the next school? Or is that you just, once you get it, you kind of allowed to do it yet?
Yeah, folks are allowed to reapply. I think we're okay giving like grants multiple years. I think we try to be fairly like diverse with new businesses that we support, but yeah, people are able to get grants subsequent years.
So then I guess my suggestion would be, you could possibly, I can see like a couple of problems, possibly skewing the survey, but maybe you could attach that prerequisite of, if you want to get another grant or a follow-up grant, you have to. If that makes sense.
Oh,
In order to be considered.
yeah,
Yeah.
yeah, that's a good idea.
And it might like encourage like vague answers, make it seem like, oh, the grant was huge help or whatever. I don't know what the questions you guys are asking, but I think even that, like, if the results are good on the survey, that would only further reinforce perhaps like a secondary grant.
Mhm. Okay, I like that.
Once the grant funding runs out, are they able to still access those like advisory sessions you said that they're your other partners and stuff, like can they still get that advice, that financial for free support? That could be another incentive if like, if you fill out the post survey, you get an additional 6 months or something of this financial support and advice or whatever that might be, you know, one of your other partners.
Yeah, some of it is like cohort specific, but some of it is ongoing and we could make the cohort specific funding like, yeah, indefinite.
Like specific incentive for each.
Yeah,
cohort.
I like that. These are great ideas.
I just have a question.
Yeah.
How are your surveys?
Via SurveyMonkey, via email. Yeah, send so many reminder emails. Yeah.
For all the businesses you're funding, will they eventually have a storefront? Like, do they have like a physical on-site location? Or do you say it's so different that you can't even say?
Yeah, I couldn't even like ballpark. A lot of them do, but it also depends on the service. Like if they're a landscaper, it's probably like they just send folks out. Yeah, yeah. So they get like 5,000 at the start and then 5,000 after the midway point. Yeah. Yeah. Yeah.
That's what like IPHS for
a lot of our work, it's like you do something, you get a quarterly payment, you submit your quarterly report. They have some of those.
Is this 40 to 50%? I assume only for follow-up. Like, I assume your initial survey has 100% response. Do they have like this?
Like 95%.
Won't get out the money until they do it, or is the initial survey like already out?
The initial surveys even after we give the money. And not, there've been like one or two that haven't responded, but yeah, usually it's pretty good at the beginning and then. And I think historically, like, it's just been this last year that we've been developing these other supportive capacity building resources. So I think it's kind of been like, here's your check. Bye. Like, we're done, except for these surveys. And now there's more of this like relationship building, which is something that we wanted to do, but just took a couple of years to develop. So maybe we'll see increased response as like we've had more maintenance with these businesses over time.
Somehow build on information about other business, like if they fill out the report, then promise that like, oh, we will send out like a report of all the businesses in your community that is like, you know, how much is other business growth, so they can see. Like, I think people really like comparing themselves, even if they know that to make them feel that like comparison and want to feel like, oh, look, I grew the most. Based on that, like, did you promise to send out?
Like a follow-up report? Yeah, we could do that. Cool. Are you raising your hand?
Just thinking about something like another, like, I don't know if you guys do like phone calls, or if like as part of, I don't know how any of this works, but like with taxation, like. Just so that it's not lost in the. I know we try to go away from paper, but, and it hurts me to say this, but I do think there is importance to like physical mail. And so I'm sure you have at least like a home address for business owners listed. And to mail something that like has marked on the envelope important or something like that, because like with email, like you can say important and like it's email. So, like I'm just gonna, it's not actually important. But mail, when it says like important action required, like that can be a big thing just for a business owner. Oh my gosh, we should like I have to look at that. So that could be another thing you could do with like maybe a URL or QR code like in there for them to fill out that survey.
Yeah, we've never tried mailing it.
Yeah.
How do you find out if any like the business,
If they what?
like if any of the businesses that aren't responding, well, like do you have any other way of finding out? Like, are you not responding because you don't exist anymore?
Oh, I don't think we've ever like gone through to verify them unless somebody's been contacted for a participant interview and they've let us know. Yeah, I'm not sure.
I don't know if there's any way to find out, like,
Yeah, that would definitely be a reason why they might not respond.
I don't know if there's a file, something like close out their LLC. I don't know.
So I've heard a lot around like requirements, incentives for them to complete it. Giving you know nothing about the survey. The follow-up survey does require like financial reporting. So we used to send it out the end of the year, the end of the calendar year. And then I think last year we decided to align it with tax day so that like they were already reporting the same information and could just plug it in. We saw no increase in responses, but I'm curious if there's any suggestions around like changing the survey itself.
How long do you think it would take? Sure.
If you have everything you need, probably like 10 to 15 minutes. If you have to go like basically do your taxes and pull all the information together, it could be a couple hours.
Do you think business owners know how to do that? Like, are they doing their own taxes? Do you think people know what they need to be saving? Because I don't know. I'm not a business owner. I wouldn't know how to do that if I was a business right now.
So we don't ask for tax information. What we ask for is like net revenue and profit and stuff like that. So if they've done their taxes, like that will be one of the items on the form. I would say I'd hope that they would know how to do that. Not everyone does, even though they're a small business owner, know how to do that. And yeah, maybe there's like a capacity issue and that's part of what we could be supporting them with. You guys decide.
Like, for making it easier, obviously people aren't gonna wanna give you like a picture of the taxes, there's a lot of people right here, go through it, think that it's too entangled with their personal taxes. Like, but, I mean, like you're saying, aligning with the taxes, that, you think that's a barrier that a lot of people, like my dad's business is a flow-through entity, so it's so entangled with his personal taxes that, like, when you're trying to solve the FAFSA, like his taxes, it was like this thing.
Yeah, it could be.
I was almost gave up on the FAFSA because I was like, how do I disentangle personal income from business income? And like, if someone asked me for him to report that, it's like, what? So like, could you give guidance maybe
Yeah,
on how they're supposed to report personal versus business income?
definitely. And this is really inspiring me around the capacity building, because I'm sure a lot of people, they kind of like just start they're good at cooking. Like everyone tells them, they start cooking for more people, they start charging people, and it just kind of like grows without a strong foundation of what business financial management actually is. That's what we found. So
If someone asked him like, what was your business income? She's like,
yeah,
am I supposed to report just the, top line that is income? No, that's something personal income. Probably, but that might be what we're getting caught up in, like, before, because they're like, have to look at this thing.
they're good ideas. Yeah.
I think we're on the same line of thinking. So what I was gonna say is that I've seen is, on some documents that help out with that, like you know which form that they would need the information from. So like, I don't know anything about that. But like, let's say your W-2 has all of your business income on it, which I know it doesn't, but you know what I mean? Like you could say like line, on your survey, when you say like, what was your net revenue? You could say in parentheses, like line G on tax form W-2, you know, and then that would be like, oh, cool, I already did that. And you just like fill it in, and then that could be really helpful. So like that would take time for you guys to even understand which line everything's on, but I'm sure that would make it.
And that's a pretty easy,
Yeah.
intervention to implement. Yeah. Yeah, yeah.
So I like that.
Great. Some structural changes. Okay, I love these ideas. I'm gonna bring them back. Okay. Challenge number 2. So this is a little bit more relevant to last year, but between 2020, 2021, Suhi did a number of grantee interviews, just to talk about their experience with the grant and also as a small business owner. And that was like right after year 1 of COVID, and people were really hurting. So folks, we heard from Suhi that people were describing like traumatic conditions and traumatic feelings, and a lot of distress and sort of alienation related to both their communities and their grantee peers. And so Suhi came back to us and one described that the interviews were challenging, like in and of themselves in the moment, and also relayed this information. So I'm curious, if you were an interviewer, how would you respond kind of in the moment to that challenge? And then to, as Westside United, like what should we have done with that information?
I think it's really helpful to have going forward from this. I mean, I don't know if this will answer your question how to remediate it or anything, but I think it's important for interviewers to have maybe an infographic or a fact sheet or a resource sheet handy with them. I think it's really important to have something physical that you can give to the person you're interviewing, especially if you're going to be asking tough questions. So like if you're going to be asking questions like what were you working in, like this, that, have on that sheet, you know, maybe OSHA is important to know on there, and how do you contact OSHA, maybe having mental health services on there, and how maybe there's places you can go where you get small business discounts or something, or employees of small businesses can access these services, or, just whatever resources might be necessary to be on this resource sheet. And that way every person can use your interviews, because that happens that sheet.
Great idea.
Are these people, business owners, grantees, are they tying their trauma and stuff like that into the state of the business as a result of COVID?
Yeah, so like,
Extending grants, these people are really.
yeah, that was one of the decisions that we made. We identified, I think, 10 or 15 of the businesses that were kind of struggling the most and gave them a second $10,000 grant. But yeah, a lot of people, they had to let their staff go. They felt a lot of guilt around that. Their business either temporarily closed down or was at risk of closing down. They lost a huge amount of revenue. There was a lot of kind of financial and personal stress.
How did you decide on the 10 or 15?
Oh, let me try and remember. I think we sent out a survey to the business owners, asking them kind of about their experiences and how their businesses were faring. And then based on the responses, like looked at those that seemed at highest risk of closing. I mean, it's not a perfect method. I could think of a lot of issues, people wanting to minimize, we're a funder for them, wanting to minimize like their description of the challenges. But that was how we approached it. Do you have any ideas about a better way to assess it or a different way to assess that?
No, I just wondered what kind of, what percentage was that of the grantees? I wondered what kind of quantitative stuff were the decisions and what kind of money you were able to get distributed as a result of, both those.
Yeah, so that year, I think there were 25 grantees, so it was about half got additional funding. Yeah.
So like the ones that got additional funding, to keep them open, did there have to be some specific requirement that they had to actually keep functioning as a business? Like I imagine for some they closed basically because they business could not function as a business because they weren't allowed to 16 other people. But like, did you only give out money to ones that could, if they had more money functioning, or did you give out ones that like you have to close?
We didn't place any requirements around them like having to or being likely to stay in business. They were all still in business when they received the second round of sort of like emergency support. And I don't actually know which ones out of those are still around. But no, we didn't, because also like, this is being 2021, we weren't really sure what would happen. And it could be that these businesses were all going to go out of business, in which case like they had debts and probably hadn't paid themselves all year. So I think we were okay with $10,000 like going to a person, even if the business went under.
You all do any like, oh, we need to do some additional interviewee training around responding to trauma and like, like this happens in interviews, sometimes you have to address other concerns that you didn't prepare for. So yeah, you all go back and like either adjust your questions and or train staff to respond empathetically, and maybe like Natalie stated, actually provide some tangible resources to assist.
Yeah, we did do that. So one of the interviewers at Suhi was like trained in trauma informed sort of research methods. And so she was able to kind of take over the interview, and it wasn't like all the interviews became very traumatic discussions, but there are a few key ones. And then they modified the interview protocol to be like a little bit more sensitive. And this actually was what really pushed us to kind of build more of that cohort model. So initially, like we had all these grantees and there was we're like, oh, there's going to be a vibe of a cohort, but there wasn't any follow-up after they got their checks. But kind of given this feedback that people felt alienated and really wanted to connect to other business owners, that's what really pushed us to say, okay, we need to start doing more like capacity building as a team. We started a newsletter and we were pushing out resources, sharing a lot of information that was also coming from the city around small business resources. We had folks connect to Allies for Community Business around like individual counseling, like business counseling. So that really pushed us to get going with our additional supports for these guys.
Something I just thought of too, that would be really cool and would create some community sense of community is everyone who has received a grant, you guys, inviting them to maybe a twice a month support group in it, just big, and like they can just meet as small business owners and either talk about, you know, like the guilt that they have having to lay off employees, maybe other people have that experience, they can talk about that, or whatever they need to discuss, you know, maybe some people don't know the financials, and someone else can help them, and it just creates community and connections. That would be really cool. But I know you said you do like quarterly meetings and different things like that as well.
Yeah, we do. We just started at the top of the year, so there's only been 3, but we do monthly coffee talks, which is kind of like that's just like an informal gathering at different locations throughout the West Side to kind of talk about your business experience. And then the quarterly ones are more around like capacity building. But yeah, I think just that informal like networking, and it's a lot of work, and I think isolating to be a small business owner, especially these business owners, it's often just them or them and like one other employee. So yeah, they need that space. I have one more challenge, but I'm also at 11:30, so I'm happy to wrap up or.
That's the last one.
Okay.
We'll do a few minutes of Q&A.
Okay, so in our first year, we found that only 17% of grantees were Latinx or from predominantly Latinx neighborhoods. So most of our grantees ended up being from Austin, North Lawndale, Westtown. And we represent sort of an equal population of Black and Latinx residents on the West Side. So if you were in our shoes, like what would you have done with that information? Who do you share that information with, and kind of what's your plan? Yeah.
With this information, I would try to just think, like, I asked like a bunch of why questions, like, why is this happening? And I would probably look inward first and be like, okay, why is this community not knowing that this is happening? Like, is the information catered to this community? Is it accessible? Is it understandable? Maybe criteria needs to be adjusted. Maybe you said that it is a pretty, like, there's kind of like lower criteria, which is the point of this, to make it accessible, but maybe, you know, a third of the businesses, there is more specific criteria of, you can say even like you need to be a Latinx, of Latinx descent or something if you're from this area. I don't know how that works, or I don't want to be exclusionary like that. Maybe there's something you guys can do with that, you know. But yeah, so I would look and see that, and then if it was like our issue of not marketing this program correctly, then I would adjust that and try to go into those spaces more and try to like figure out how can we enter those spaces in a good way and in a way that's productive and makes causes awareness.
Great. Yeah.
Like, so out of that, we have like you have to check that import, but also I guess targeted survey, right? There is 17% of grantees who are listening. So perhaps like a survey to them, like what compels them to actually do it?
Mhm.
And I'm sure they have been down before doing that. So what were the reasons why that might have stopped them from actually trying to apply for the grants?
Mhm.
So because the best source is actually people. And I'm sure they have many reasons why they were probably not applying until they did.
Mhm.
So all those reasons are very valid. They're the best source.
Great idea.
One, like maybe to try to get more, like, either business owners that did apply for the grant, like maybe do some kind of referral program. Like
Oh.
reach out to your current Latinx application and awardees and say like, oh, if you refer, maybe you get $100 for you, and like then you'll reach out to them to give them the application and offer support in filling out the application.
Well, I like that idea. Yeah.
How were the grantees, how did people become aware of these grants in the first place?
Good question. So we posted it on our website and our social media, which we don't have a lot of followers. And I don't think people are regularly going to our website. So we also did info sessions. And year one, they were in person. So we worked with community organizations that were partners of ours to host the sessions. So for instance, like the Pilsen Chamber of Commerce hosted one, and we went and like talked about the grant, did a Q&A, FAQ. There's a Austin like business network that we went to. So basically throughout the neighborhoods.
But there was less pickup then, probably close to the village, those kinds of areas, applications.
Yeah, fewer applications, a lot fewer applications. I'm not sure about the attendance at the info sessions itself, though.
It seems like there's a. It seems like that's part of this. More people aware of it.
Mhm.
It's like there's plenty of government business.
Mhm.
Well, and it seems like the people who would become aware of it are those who are already actively in those spaces, and so that can cause, even with the referral program, I think that's a great idea, and I think that was only $100, you could have that issue of, you know, someone, a developer who's already kind of, or not developer, but like a small business that's already in that space that might, they could help other people out that you might not that you don't want to help all small businesses, but maybe there's other people to prioritize.
Mhm.
Because that can get a little tricky if you're like, oh yeah, we bring all my friends, and then you're missing out on the good portion of people.
Mhm. Mhm.
Clarifying question, so.
Yeah.
I'm assuming 17% is referring to the people that actually were granted grant.
Mhm.
Do you know how that percentage, I kind of like referred to it earlier, like what percentage of applicants were Latinx?
So that was, I don't know off the top of my head, but that was something that we looked at. Like, was it a problem with our evaluation of these applications? Because that would get us to this number if we had like 50% of applicants. But we did find that there were a lot fewer applicants. I don't think it was as low as 17%, but it was pretty close, like 20 to 25%. Yeah.
Just like that, it's kind of anecdotal, and kind of based on my own personal experience. But I'm Latinx, and like my family has its own small businesses, and I have like family friends that have their own small businesses. I feel like a very common problem, and this is very anecdotal, slightly, is that like there's, especially with older business owner and like Latinx communities, their computer literacy is like, isn't as like at the level maybe more naturalized or like naturalized into the US. Especially if they're like immigrant status. So maybe that could be a part of the issue, especially if your application process is very reliant on computers and knowledge on taxation and revenue and stuff like that. So maybe, I don't know, adapting some part of your programming where you actually help. Maybe you already do, but like help these more directly help small businesses in the application process.
That's a great idea. So I'll share, when we saw this, we focused on Spanish language. So our application was available in Spanish, but we made sure no one on staff then we had some Spanish speakers on staff, but the person who's running this program did not speak Spanish. And so we were really focused on that. But I think, to your point, there was an issue around, because the applications were both online. So this last year, Allies for Community Business had in-person like drop-in sessions where they would help people fill out the application and kind of guide them through the question. And we had actually quite a few applicants through that method. Yeah.
Going along those lines too, and I was wondering how the grants are framed as well, because I know people don't tend to say those like free money, but if it is framed around like a handout or something that isn't like works for, sometimes like small businesses pride themselves on the fact that they are grassroots, but they've like, I don't know, and I know that certain communities like do pride themselves on hard work and earning things. I don't know if there's an issue with that as well, and that could be a small percentage too, because I don't think you guys are doing anything wrong with the way you're framing. You guys are giving out free grants, like it's awesome, so like there can't be wrong with that, but maybe just considering that or asking people that, like, is this framed in a way that wasn't attractive to you? Why not?
Yeah, I think that harkens back to the need to, we talked a lot among ourselves, but we should really talk with community members and the applicants and the grantees and people who who didn't apply about what they would want to see. Yeah.
I think also considering, I don't know, I'm not sure if like the grant is, what do they call it? Like, for like undocumented, people, they're, they can't apply for certain things because like it could go against their like, immigration status. So I'm not sure like if the grant, reports that back to the federal government, but that's like another stigma that happens in like the Latinx community. So that could be like, one of the reasons why they're very like hesitant to apply for anything. Just like in general, because like no one gives out free money just like that.
Yeah.
And then another thing would be is like, I know you mentioned that there wasn't a lot of like Spanish speakers. So probably hiring more Spanish speakers to, directly work with the Latinx community. I wouldn't like really recommend translators just because like in my personal experience, a lot of like the Latinx clients that I've worked with, they didn't really like having a translator because there was no like, they couldn't talk to them directly. And then some things could be like miscommunicated. Especially because like regarding there's like different cultures within the Latinx community, and so like things are understood differently because not all Spanish is the same Spanish. So yeah.
You started off asking us the question, how many of you have heard West Side United? So I just wonder about surveying a large group of business owners, both, in Spanish speaking areas and Black areas, about how many of them have heard the advanced program. So it's some idea.
Of what like our knowledge penetration is. Yeah, good idea.
Probably unrelated, but, like, I was thinking for like giving us, like, no one gives out money for that. And then, how many of the applicants are immigrants, like I know the police department is sponsoring my husband's green card right now. And I have to sign something saying that if he takes any government money in the next 3 years, I am personally responsible to pay that back. And so I'm wondering if like a lot of your applicants, the potential Latinx applicants are immigrants from British families, that there may be some worry that there may some like, it's hard, especially in public health programs, like the money may come from the government or like, it's hard to know, like there's that fear of like, it's basically money, right, that you're someone is somehow gonna affect immigration status or like if they're being sponsored for a green card or sponsoring someone else for a green card or like anytime you touch immigration. Any capacity and money to get way too complicated. And I wonder if that's affecting business owners or wondering.
So maybe being really explicit that it's not tied to documentation status or doesn't have to be paid back.
Like I was very surprised. Why? Why is that part of the
It's terrifying. Yeah.
Kind of like what Dan was saying there, it like made me question, so does like your organization, do they have like actual sites in the Latinx neighborhoods, or is there just like that, like one headquarter type thing?
So our offices are in North Lawndale. So yeah, we're really relying like on our partners that do have offices in the neighborhoods.
I would like kind of to go off that, that's, they probably also haven't like seen, the organization. So that could be another reason why they're hesitant to apply for the grant. Gonna say something else, but I forgot.
Yeah, so just about getting out there.
Yeah, that's another reason why, just, they probably haven't heard of it. And then also like coming from like an outsider perspective, like, your West Side just comes in like randomly during like community events or something like that. Instead of like building that relationship with the community. Because I know Latinx is like very like heavily based on like community and like trusting relationships. So I think probably more involvement West Side would be like
More trust building, relationship building. Yeah, definitely. And that's like a long-term project. Of course. All right. Yeah.
Just like last thing, I think other people kind of touched on it too, and again, it kind of has my own anecdotal like experience, but I think kind of emphasizing, especially in the in-person events, where you're advertising the grants in the Latinx communities. I think that it would be important to have like a slide or at some portion to talk about your guys' relation with, especially undocumented workers, and how, I don't know, your guys' handoff approach on that. I think it'd be important to reinforce that you guys were not, or like, I don't know, it wouldn't be concerned at any point of if they hired undocumented workers or if they were paying under the table. Again, on your guys' behalf, I don't know what the legality of that is. I can understand it might be a little smoky on that end, but I don't know if your goal is to increase Latinx grantees. I think there would have to be some mention of undocumented workers. Your guys' relations that, and just kind of ideally reinforcing that, like, we don't care if you guys are using undocumented workers. I mean, it's just a reality, especially in Latinx communities. It's just a reality. So I think at some point you have to kind of address that if you guys aren't already.
Yeah, be explicit. Good suggestion. Okay, that's all I've got. Do you have any questions for me?
Yeah, any final thoughts or questions for Eve?
I just wanted to thank you for engaging us the way that you did, because a lot of people, a lot of times we get to talk there, and this was a very different experience. So thank you.
Good. I'm glad you enjoy it. You're lucky my wife is a teacher, so I got some help.
I have a question about like your personal journey. You said first you went to like the big kind of corporate organization and then went to the small startup. If you were like doing your career path over again, would you still go work for a big corporation first? Or would you go straight into the small startup world? Like, do you think they lend to each other, or do you like working with better and both?
I mean, like the grass is always greener. When I was there, I was like, this is so stiff, and you like call the one person who does the one thing instead of more people being responsible for more activities. But now all I want is like someone to just take care of, whatever operations. So it's like, I think it was easier to be in that environment. I could focus more on my work than on like the operations of an organization. And now like everyone at Westside United has to do a little bit of that operations type of work. So I don't think I would do anything differently. I will say I was like kind of bored at NRC around year 4. So maybe I would have left then. And it's always, well, I think it's scary, but I don't think I've ever made a big life change that I haven't been really happy about at the end. It's challenging, but it was like the time to grow and do something different.
Any other questions for Eve? Give her a round of applause.
Thanks, everyone.